just briefly, and this is to thank our sponsors, and we also want to provide an opportunity to hear a presentation from Mandy Doon from CSnet on joining up for better outcomes. Mandy Doon has a wealth of knowledge in terms of exactly what we were moving into right then, how to build and understand the difference we're making. She's a co-founder and executive director at CSnet. And CSnet is an Australian cloud software platform for human services, case management and outcome measurement. Over to you, Mandy.
Thanks so much, Mandy. This has really been a session of the Mandys, hasn't it? So big shout out to all the Mandys. Thank you. Can I also acknowledge that I'm being with you on the beautiful lands of the Turrbal and Yagara people here in Brisbane. And I want to acknowledge elders past and present, and to also acknowledge any Aboriginal people who are meeting with us today. It's an absolute delight every year for CSnet to be a sponsor of the Open Symposium, and the quality of the work that's being done and the sharing of that knowledge is just so critical to us, working hand in hand to solve these really complex social issues. So it's been fantastic listening to those, and thank you very much to everybody for their efforts. It was really lovely to hear the work of Carolyn Chisholm and Impact Initiative. Carolyn Chisholm are a CSnet organisation, and so that data is being collected in CSnet. So it's lovely to see how that data, when it's being collected, is being used from ground up and then being used for an evaluation where you can be really confident that that's the data that's being collected every day, and then make the links to being able to see patterns. So thank you, Lolo, for your insights. It was fantastic to hear. I'd just like to click through a few things just to kind of share, I suppose, some initiatives of what we're doing in Victoria in particular, but also more generally. So for those of you who do know us, you know that what our purpose is. And today, what I wanted to do is to talk a bit about how we're partnering with our CSnet organisations and with government agencies to bring a joining up approach to how you have to report the data, and starting right from when the data arrives to you, the referrals and how you manage that, then how you do the assessment and planning, record the service delivery parts of the work, and then to report. I'll just touch quickly on our practice framework and also to mention a new CSnet collaboration database model, which we've just gone live with in Queensland, which we're very excited about, which brings together multiple organisations around a specific data set and a specific outcome and a set of measures which we think will really support that collaborative effort that networks are looking to provide, and also just helping from a technical perspective to make sure that it can be nice and streamlined. So for those of you who know, we're a certified B Corp. Our customers are our organisations, and they're absolutely fundamental to our theory of change, and working and measuring our impact in these areas of governance, workers, community, the environment and customers is significant for us, and it makes us who we are as a B Corp. We're also certified as a SOC 2 Type 2 SaaS, which means that you can be confident that we are protecting the data that you give to us as stewards, and you retain the ownership of that data always. In terms of how we join up, the snapshot of CSnet through our impact report, and we'll be releasing another impact report by the end of the year, is that organisations we work with are multi-program, multi-funded. So we need to find a solution which deals with that, because we can't work in silos. Otherwise, we can't do this kind of outcome measurement and being able to see the range of things that are really important for impacting on better outcomes. We've got nearly 500 programs in CSnet now out of the box across all levels of government and philanthropy across Australia. There's over 200 different survey and measurement instruments that can be generated from the CSnet for real-time insights. And then those surveys can be used to map to many social outcome frameworks, not collecting more and more data, but remapping the indicators in a way that every time a survey is completed, it can be mapped to multiple outcome frameworks. It's a really important part of the system in helping to do the joining up and reducing the amount of effort that's required in collecting that data. There's a lot of data which supports, shows the support for clients in a single year that's collected in CSnet. And really pleasingly, when we look at our data and the usage data and the change over time, we can see there's a much greater an increase in using the system to measure outcomes, not just as a previous presentation was showing about understanding outputs and demographics, but also using that with the outcomes data and being able to do the analysis. So the reports are really critical, more and more use of the reports in CSnet. We're moving to embedding Power BI into our reports, and that will drive the dashboards as well. So it's great to see that not just the collection of the data, but the use and the analysis of the data in the system. We join up programs and services. So there's some examples of the programs that we link up to. In terms of the sectors we support, as I said, CSnet is multi-program, multi-funding. So across a whole range of these programs and service areas. And it's because that's the work that you do. You know that people will not need just a particular support in a particular program, but it'll be the combinations of support that might be funded from a range of different sources that are needed to provide that wraparound support for your clients and families. So there's 3 areas that I wanted to talk about in terms of, it's particularly in Victoria, that we think are really important for the joining up part and trying to help organisations to streamline that, to manage the data securely, and also then use the connections that are much more streamlined if we can do it this way. CSnet has built a feature called inbound data. And it means that you could be collecting referrals, and it's interesting to listen to the speakers about how much, in terms of reaching out, people are doing self-referrals. So how do those people get in touch with your organisation? You could have a web form that's on your website. Somebody could put in an inquiry or request for service. It will land directly into CSnet, and then that data and the referral information can be reviewed by your teams. You could identify that person might be eligible or more appropriate for one program rather than the other. And so the intake and referral process then starts when the data arrives in the system. And so it's right from that moment that it's secure, and then it can be streamlined. You're not doing duplicate data entry. So the inbound data feature is a really important part of what we've been building in CSnet. And using that feature, we've been working through an invitation from Family Safety Victoria to build the integration between CSnet and the Orange Door. So that means what we're looking at is using the API, which is the technical bit, to allow for referrals to be drawn down from Orange Door and sent back up to Orange Door if you're an organisation that is part of that Orange Door collaboration. The trial has started, and we've successfully sent some data up. Some data has successfully come back down. The trial probably, now we're working with the department, it'll be in the first half of 2025 when that gets going, and probably there's, at the moment, it's the inner and outer east regions that have put their hand up, and VACA and Doon, who are organisations who are our partners, will be working as part of that trial. So for us, it's a really exciting use of the technology to be able to make that more streamlined, manage risk. You will see those referrals in real time as soon as they arrive. So that's a really important part, we think, of the system and managing the system. Now, once you receive those referrals, of course, you then need to do needs assessment. You need to do the planning and service delivery, and that can all be supported in CSnet. Well, one of the things for the Victorian organisations is the use of the MARAM tools. So we've embedded the use of the MARAM tools in CSnet, which means that you can collect the data, not only of all of the other information that you want to collect, but you can collect the MARAM fields and information in one place. And then CSnet helps you to generate a report which looks like and it mimics the MARAM document itself. So this is a really important part of the integration and being able to see a MARAM needs assessment next and alongside your plan and alongside your safety plan. So this is a way that CSnet sees itself as being able to support that and integrate that. Finally, of course, you will need to report your data. And so CSnet, some years ago now, built the integration between CSnet and IRIS. Whatever happens in the future, we will continue to have an integration from CSnet to whatever platform it is where your data needs to land. But that provides an opportunity for people to be simply sending the data, which is then brought together in CSnet and sent to IRIS for your to meet your compliance and reporting requirements. Just quickly, this is kind of we will send out the PowerPoints if people want to have a look at this in more detail. But this is kind of the description of how the Orange Door trial works and how the referral management system will work. I'm going to move along because I want to just touch on the MARAM as well, which there's some information there about the benefits of embedding the MARAM so that practitioners can see the data as it's filled out and can update it in real time across the different activity types and share that within your organisation. And to also create organisational level risk registers. So if you're collecting the data in one place, it means that CSnet can also generate a report for you, which would show you the risk register, which has basically a row per client. What's the MARAM? What's the risk? And so you can see that in one place. The IRIS integration, you'll know, is something that in terms of the reporting, you've got to do every month. So in CSnet, we create the integration between the IRIS IDs and the agency codes and all of those things in the system. That as soon as you establish somebody in CSnet, those IDs and links are created. Then you create and add your data through the CSnet screens. CSnet picks up validation errors, which means that we anticipate, because we know what the minimum data set is and what's mandatory and what's required. It's going to say, hang on a minute, you've got an error in there, and please, for the worker, you're on the ground and you're working in this case every day, there's something you need to fix. This is the error and this is how to fix it. If I'm the team leader or program manager, I see the overview of all of the data, and I can also identify whether there are validation errors need to be addressed. I want to just quickly touch on our new collaboration model, because this is something, as I said, is really exciting for us. So the work that we're doing around case management groups and community projects, of course, is in CSnet. That's how it works now. Multiple programs, multiple surveys, multiple outcomes frameworks. The hub and spoke collaboration model that we have built is almost turning that inside out, in that you have a group of organisations as a network who say, actually, we'd like to collect this little skinny minimum data set, and we'd like to use this particular assessment tool or survey, and we're all going to put our data into this collaboration space, which is the database. And we can then see the data that we are sharing and see change over time in terms of our collaborative efforts. So in terms of a collective impact model, this can be varied according to however a place-based set of network of organisations want to work. Now, the way you can see here, it could be a spoke, where you've got 3 different communities that are working in one. It could be another spoke with it, which is a different region and a different location where there's a couple of communities working together. The spokes can be configured and added at any time by simply doing reflecting this is a common data set that we're all going to work towards putting our data in. And if you wanted to have a function of a hub, it might be that you have every night data is sent from these separate databases in a de-identified or aggregated way to a hub, which would then be able to see that de-identified or aggregated data over time across multiple spokes. To make that real, what does that actually mean? In Queensland, CSnet has used the hub and spoke collaboration model for the A to Z campaign. Now, this is Advance to Zero campaign. It is about measuring homelessness and measuring vulnerability as a way of prioritising and working together as a coordination of networked organisations around addressing housing support and housing placements. And this is an example here of, there's Brisbane Zero, Gold Coast Zero, and Logan Zero. They're all contributing the same data set using the same assessment tool, which has been adapted for Australia, called the Australian Housing Vulnerability Triage Tool. And they form communities of practice around how they're going to collect that data, how they're going to reflect on that data, and then how they work as a collection, however they manage that and want to identify that as a place-based, to then address the needs that they can see from the data. So it's data-driven and really clear outcome measurement. So it's a new initiative and it's just gone live, and we're pretty excited about that. We also think that this collaboration model as a technical option is really exciting and has lots of potential across lots of other sectors. Mandy, where am I up to with my time? You can give me a little flag.
You've got it 2 minutes, but that would be all of your time.
Okay, all right. Maybe I stop. If there's are there any questions? What I can see here now is a screenshot of how this actually looks in the system when you can connect your theory of change to your practice and outcomes framework, how you can measure your measurements showing in that little graph against the headings in terms of the plan. But I will stop in case people have got any particular questions around what I've covered. I'm keen to hear any questions if there are any.
We have had a lot of grace. This looks like it's really needed and can't wait to see how it will play out. I'd be interested to know how your organisations you're working with have experienced the joined upness of that approach in terms of the efficiency and ease in which they can access their data.
Yeah. I think if I just click on a few here, there's a couple of case studies on our website that I'd refer people to, because I think it's really helpful rather than me kind of go through the detail.
Yeah.
One is around how VACA's using CSnet to embed Indigenous cultures. So they collect the data they want to, and they embed their outcomes frameworks. They embed their cultural therapeutic ways in the system, which is a really critical thing for them to say, this is the system we want. We want workers every day to see that on their screens and to actually understand the contribution that they make every day through the work to the meeting of those outcomes. The other little case study you can see here is also from Newcastle Family Support, and the joined up part of it, which is what you're referring to, Mandy, is when you've got the data in silos, it's really hard to see the journey across. So what CSnet does is to say you can have a common data set across all the programs, you can have visibility across the programs and use some common tools, which then give you an organisational view about that instead of a programmatic view. And so, yes, if you're interested in this, there's some great bits in the case studies around how VACA are using the system, not only to collect the data, but when the data comes out, this is also joining it up to some very beautiful artwork and themes that are really critical for reinforcing these are the outcomes and making people proud about being part of this service and what you're working towards in terms of the family. Also, in terms of for Family Support Newcastle, and I think this is relevant to an earlier discussion, if you just look at numbers, then you will just see numbers and they don't have meaning. What we need to do is to join up the numbers to the narrative. And this is this little quote from Family Support Newcastle, where they really were raising something which had been raised in previous presentations today. If you just look at those numbers, if I'm a person who is at risk of going into the child protection system and losing my children, I'm going to rate myself pretty highly as a parent. Yeah. It's only when I have got a trusting relationship with those workers that then I can actually reflect and say, actually, maybe I'm a 5, maybe I'm a 3. But what it looks like, if you just looked at that numbers, is this person is now less confident, is less skillful, is less capable as a parent, when really that's not the story at all. So you can see in that case study how Family Support Newcastle said we could see the numbers, but we knew that from a narrative perspective, we needed to capture that other part of the story. And so to be able to join up the numbers with the narrative is really critical. And the way CSnet can be configured can allow you to do that and then bring the reports out so you can do the analysis of that as well. I'm sure I've used up all my time, but thanks again so much. As I said, we're delighted every year to support Open Symposium. So thank you particularly to you, Mandy, and to Sarah. We really appreciate the opportunity to chat with you and to hear the other presentations. Thanks so much.
Yeah, thank you very much, Mandy. It's been a pleasure as usual, and providing lots of food for thought across all of these different presentations in the way in which careful consideration delivers such great outcomes, and evidence being a part of that. So thank you very much. Thank you to our sponsors again. We're now going to have a little break and we're going to come back at 2 o'clock. I've loved the sessions and thank you very much for sharing so generously with the rest of the sector.